Why every time? Okay, just a minute. Subscribe the channel. Yeah, good. Now audio video everything is fine. I'll start. The question number one. It's a predictor series. Next to 1 hour, it is a predictor series. I will give some prediction. We may get these kind of questions. Now audio video everything is fine. I'll start. The question number one is a sorry, my speaker is on. Okay, start with atypical pneumonia in a college student was diagnosed. Culture was negative, but routine culture. Cold agglutinin test was positive. What is the likely causative agent? What is the clue here? Here the clue is cold agglutinin test. Cold agglutinin test is positive for usually Mycoplasma pneumoniae. Usually culture negative pneumonia. We call it atypical pneumonia. Usually culture negative. It is caused by Mycoplasma, chlamydia pneumoniae and Legionella. Mycoplasma, chlamydia, Legionella. And you should know about the name of the test. Sometimes the test will give you a clue to you to choose the correct answer. For example, see carefully here. See the test. Some test. Okay. We call it as microscopic agglutination test. Leptospira, that is a gold standard test. That is called MAT. Second one is CAT. That side. CAT. CAT is Mycoplasma pneumoniae. Standard agglutination test, SAT-B, is for brucellosis, to know the brucella antibodies. Fourth one is DAT. You can go for direct agglutination test for leishmaniasis. Kala-Azar, leishmaniasis. So you should know about MAT, CAT, SAT, DAT, everything. So first of all, you should know name of the test and the specific diagnostic agent. That correlation you must know. Very good. Next is, which of the following toxin inhibits protein synthesis by ADP ribosylation of elongation factor 2? Always toxin question. It may be toxic to you, but you are reading microbiology. So 100% we have a question on toxin mechanism of action. Toxin mechanism of action. See carefully here. Tetanospasmin, Shiga toxin, diphtheria toxin, cholera toxin. Which acting on elongation factor 2 is diphtheria toxin and also Pseudomonas toxin. Diphtheria and Pseudomonas toxin. They act on ADP ribosylation, elongation factor to inhibit protein synthesis. Shiga toxin acting on 60S ribosome or 28 ribosome, that also inhibit protein synthesis. Tetanospasmin inhibit the release of GABA and glycine, where cholera toxin increasing cyclic AMP. So always you know about one slide of mine always gives about toxins, always talks about toxins. You should know this. All these images you'll get the PDF by today evening itself. Don't worry. Okay, see. Important 10 toxins, many are there. Diphtheria, elongation factor 2, same thing by Pseudomonas, exotoxin A. Botulinum toxin inhibit the release of acetylcholine, GABA and glycine, spastic paralysis, flaccid paralysis by tetanospasmin and this one. Tetanus toxin inhibit the release of GABA and glycine. And heat labile toxin cyclic AMP, heat labile stable toxin cyclic GMP. Shiga toxin 60S ribosome. Alpha toxin lecithinase activity, Clostridium perfringens. like that. Bacterial petosis, increasing cyclic AMP, increase cyclic AMP. I give just 10 examples. Many are there. If you see my notes, many are there. This is important. This is you must know. Okay? Right. Next is, you must know the mechanism of action of toxins. You must know the mechanism of action of toxins. Next is, image shown here is characteristic of pathogen which belongs to bioterrorism category A. One stone, two mango. We can discuss in two ways. One is image. See the image. How will they look like? It's look like. See the image carefully here. See this image exactly how they look like. It's look like safety pin appearance. So I can discuss bacteria which is having safety pin appearance, bipolar staining. Or another way, I can discuss agents of bioterrorism agent category A. So you should know two things. You should know two things. Safety pin appearance. Always remember, classical example is Yersinia pestis, Haemophilus ducreyi, Borrelia burgdorferi. All these people are safety pin appearance. Brucella, Vibrio parahemolyticus. So there is a list is there. Important bacteria which produces all available in my group. I am taking the things from a group only. Don't worry. Safety pin appearance. Safety pin appearance. See, it start with Yersinia, all Yersinia, Haemophilus ducreyi, Vibrio parahemolyticus, and Pseudomonas, Barboteria pseudomali, Klebsiella granulomatosis. I want to confuse you, because of that I gave everything. Okay, Haemophilus influenza I gave. And Pseudomonas pseudomali, old name I give Pseudomonas aeruginosa. Klebsiella pneumoniae, I am giving Klebsiella pneumonia gave, but actually Klebsiella granulomatosis. These are all safety pin appearance. The mnemonic is, you have very beautiful kitten. You have very beautiful kitten. Everybody loves the kitten. Got it? So sometimes you may get a question like this. Chinese letter pattern. Pattern based. Chinese letter pattern, comma shape bacteria, drumstick bacteria, lanceolate shape bacteria. Something we give. We have. Okay. Next is, which is not a part of torch infections. You are aware of that. Okay, you are aware of that. Which is not a part of torch infections. Okay, which is not a part of torch infections. Yes. You know torch. What is torch? It's a congenital infection. T for toxoplasma, O for others, R for rubella, C for, many people think C for camphor, no, C for cytomegalovirus, and H for herpes, hepatitis B, hepatitis C, HIV, all those people. So previously it is called torch. What is the new name? Now it is called starch. They can include others, parvovirus, even malaria, plasmodium, Zika, anything. So everything is herpes simplex, rubella, toxoplasma, except Campylobacter. See carefully here. See my dears. See the picture. No more torch. So now it is called scorch. In the scorch, you should concentrate on other viruses. Other viruses which includes Zika, malaria, Chagas, parvovirus, enterovirus, anything. All others. See the list of all other viruses. That is important. Almost 17 to 18 are there total. If you see overall. H stands for herpes simplex virus, HIV, HTLV, hepatitis B, hepatitis C, all H. And C for chickenpox, scorch. This C is for cytomegalovirus. So you must know this. O for others, syphilis, varicella, etc. Yes, you are right, Rizwan. You are right, Rizwan. Next question is, which of the following is most heat resistant microbial structure? You should know this, because if you are practicing sterilization and disinfection, you should know which heat I need to apply. For example, enveloped viruses, even 50-60 degree you can kill. In case of spore, more than 100 degree you need. In case of prion, more than that. So you should know the different structures. which is most heat resistant among the structures is spores, bacterial spores, not fungal spores. Bacterial spores, not fungal spores. Second trimester, you can think of varicella as well as syphilis. Okay, right. See here, the structures, all these pictures you will get as a PDF. See the structures. Lipid enveloped viruses are least resistant. Next is gram positive bacteria. Next is non-enveloped viruses. First enveloped, gram positive, non-enveloped. After that fungi. Next is gram negative bacteria. Next is protozoa, trophozoites. Next is cyst. Mycobacteria, staphylococcus or another group. Finally, spores. Spores are most resistant practically. What you are using practically, spores are most resistant. But don't worry, one king is there. Who is that king? Already told, prions. Prions are more resistant than. See this top is prion. See here, top is prion, spores, mycobacterium, protozoal things, vegetative forms, gram negative. Next to gram negative, fungi. Don't worry, the least one is lipid enveloped viruses. Enveloped viruses. Got it? Right. Sometimes they may ask a question. That means you have a question at sterilization disinfection. Because previously I discussed quality control agents. Previously I discussed what are all the temperatures. Previously I discussed what are all the concentrations and applications, Spalding classification. Along with, you should know what are all the high resistant to low resistant. Important, my dears. It's important. Must know topic. Must know topic. That means read sterilization disinfection full. Which fungus shows broad base budding? Always remember, I used to tell BBB, broad base budding cell is blastomyces. Figure of 8. Snowman appearance. See here. Blastomyces, dermatitis. Histoplasma, it is inside the yeast. You can get inside the macrophage, yeast cells. Inside the macrophage, you have yeast cells. Cryptococcus neoformans, it is capsulated budding cell. Where Candida albicans pseudohyphae. See the snowman appearance. Every image you will get, don't worry. Every image you will get. These are all the flashcards already available. See exactly figure of 8. See figure of 8. Okay, figure of 8. That last one is snowman appearance. All are right. Snowman, figure of 8, broad base, budding cell. Got it, my dears? Yes, Cryptococcus, India ink, music, carmine stain. We can discuss a lot. This is important. And if you want to know the disease, histoplasma causes Darling's disease, blastomyces, Gilchrist or North American blastomycosis. Cryptococcus, most common cause of fungal meningitis in HIV positives. Candida causes oral thrush, esophageal candidiasis, moniliasis, etc. Must to know, my dears. These are all must to know. Next is a patient with chronic diarrhea has acid-fast oocyst in the stool, which is the likely organism. So acid-fast structure, chronic diarrhea, okay, especially HIV positive or any immunocompromised, that point is not given, but you take it as granted, is coccidian parasites. So what are all the coccidian parasites? CCC, Cryptosporidium, Cyclospora, Cystisospora. You should know the difference. 100% one question may come in NEET. On NEET. Okay. See the 3 people, acid first people. See the acid first people, 3 people. Usually 4 to 6 micrometer. I cannot see it's 4 to 6 by, if I made like this maybe 20 micrometer, if I do like this maybe 1 micrometer. It's a digital, okay, but I can guess it is cryptosporidium because it is round, uniformly stained. It is uniformly stained. Size is around 4 to 6 micrometer. This is, I can say with the help of, this is called ghost cyst. We call it as ghost cyst. Partially acid fast is cyclospora. It is partially acid fast. It around 8 to 12 micrometer, 8 to 10 or 8 to 12 micrometer. 8 to 10 or 8 to 12 micrometer. Automatically this everybody can answer. Oval shape, oval, elongated is cystisospora. Elongated is cystisospora, ghost cyst. Yes, you are right. If people see in my DVT, they can enjoy the ghost inside this. This is a typical ghost cyst inside. You can enjoy one ghost inside if you see my DVT slides. Can you remember, my dears? Yes, it exhibits autofluorescence. Perfect. Who mentioned it? Okay, the scavenger. Yes, autofluorescence. One question we can get from either toxo or coccidian parasites or plasmodium, that group. One question we can get from trypanosoma, giardia, those kind of groups. Got it? Right. Next is, all these pictures you will get it as a PDF by today itself. I told the people to upload by today itself. Don't buy. Okay? Right. So patient with chronic diarrhea, acid fast, I can go for cryptosporidium without size or shape. Suppose if they gave other choices like cyclospora, cystisospora, that time they will give some clue to you, size and everything. Got it? Entamoeba histolytica produces bloody diarrhea, not chronic, bloody. We call it as amoebic dysentery. Amoebic dysentery. Naegleria causes what? Not diarrhea. Amoebic meningoencephalitis. Where giardia, what is it causes, my dears? Giardia. Giardia causes, listen to me carefully, steatoria. Yes, flask shaped ulcer. Techie, you are right. Techie, you are right. Steatoria, malabsorption syndrome, megaloblastic anemia, foul smelling frothy diarrhea. Foul smelling frothy diarrhea. Got it? Foul smelling frothy diarrhea. Next is, okay, next is, listen to me carefully. Just a minute. Yeah. Common cause of malignant otitis externa. Malignant otitis externa, temporal bone involvement and necrosis, and do not forget swimmer's ear, diffuse otitis externa, swimmer's ear. Everything caused by Pseudomonas aeruginosa is an important pathogen. Pseudomonas aeruginosa, Staphylococcus, Streptococcus, Mycobacterium tuberculosis, E. coli, okay, syphilis, Trichoderma pallidum. These people are major important pathogens. Important pathogens. Vibrio. Okay, right. These are all major pathogens. Pseudomonas aeruginosa. Suppose Proteus causes UTI, you need to know that with renal stones. I am not asking tough questions to you, my dear, today. I didn't put very tough questions, extreme questions to. No. I don't want to shake your confidence. This is typical NEET level questions. NEET level questions are common questions, common points. If you see the old 10 years question paper, anything very tough, throat, strangulating your throat. Questions are easy because of your panicity. I keep on telling, because of your panicity, tension, everything, multiple other factors, it will not allow you to perform. After the exam, you people will come and laugh. This question, this is the question I struggled. Okay, right. Candida albicans, you know that. Klebsiella pneumonia produces low flux pneumonia. Sorry, Friedland's pneumonia, slip of the tongue, low flux pneumonia, ascaris. Okay, low flux pneumonia, ascaris, Friedland's pneumonia. Yes, BMR, thank you. She say God bless me. Thank you. Okay. Next is low flux pneumonia, ascaris, other people. You must know, these are all you must know, my dears. Next question. And Pseudomonas aeruginosa causes many things. Ecthema gangrenosum. Hot tub folliculitis. Okay, hot tub folliculitis. Hot tub folliculitis. Many things. So among the 4 choices, I can go for, who is this? Pseudomonas aeruginosa. That's all. Next is, which test differentiate Streptococcus pneumoniae from viridans Streptococcus? Streptococcus pneumoniae and Streptococcus viridans both are alpha hemolytic. Remember 5 basic points, laboratory points. One is Coulomb reaction, demonstration of capsule. Another one is bile solubility. And inulin fermentation. Optochin sensitivity. And in blood agar, Draughtsman colony, Karamcoin colony. These are all the 5 major differences which is seen in Streptococcus pneumoniae and not seen in Streptococcus viridans. Okay, all are present in pneumonia, Streptococcus pneumoniae, pneumococci, all are absent in Streptococcus viridans. Absent in Streptococcus viridans. See carefully here. Because both are catalase negative. All Streptococcus both catalase negative. CAMP test for group B Streptococcus. Always remember, recent INECT they asked which test from the workbook. Same picture. Satellitism they asked. Like that they may ask CAMP test or reverse CAMP test. Anything they may ask. Nowadays we are getting one microbiology question based on the diagram of the test. Okay. So basic trust in sensitivity you can go for group A Streptococcus. And optochin sensitivity positive for pneumococci, negative for viridans. It is positive for pneumococci, negative for viridans. Got it? Nice. Which virus use reverse transcriptase during replication? Reverse transcriptase is an enzyme usually present in retrovirus, HIV virus, HTLV virus, those people. It used to integrate with host genome. It used to integrate with host genome. Our genome, it integrate with the help of enzyme called integrase. That is HIV virus. Don't get surprised. Same reverse transcriptase seen in hepatitis B virus. It's a DNA virus. D virus, but the beauty, it is not using it for its It is not using it for attachment, integrate with your host. It's only using it for its multiplication, replication purpose. How, sir? What is the function of reverse transcriptase? Convert single stranded RNA into double stranded DNA. Where is the RNA in hepatitis B virus? There. Hepatitis B virus is partial double stranded. One strand is full, another strand is partial. It's look like RNA, act as RNA. So it make it to complete double stranded. So it need reverse transcriptase. It need reverse transcriptase. Hope you people understand this. Okay. Hepatitis B possesses reverse transcriptase, but it never used for integration of the host. It use it for its replication purpose. It using it for replication purpose. Got it? Next is child with fever, sore throat, sandpaper rash and pastia lines. What else you want, my dear? They give the full diagnosis. They'll ask, what is it? Sandpaper rash, sore throat, sandpaper rash, sore throat. Anything else? Strawberry tongue. Very good. Is caused by scarlet fever. All are features of scarlet fever. All are features of scarlet fever. Kawasaki disease also has strawberry tongue. Fever rash, you can think of measles also, rubella also. But pastia lines, diagnostic of pastia lines in the popliteal area, many places. Okay, you can think of scarlet fever. Scarlet fever. A pastia lines are clinical picture of scarlet fever. It is lines present in the popliteal area. Scarlet fever. Okay, it's a full clinical entity. Pastia line is a clinical entity. Got it? Don't worry. Sandpaper rash, sore throat. Don't worry. Even if you don't know pastia lines, sandpaper rash, go for Streptococcus group A, scarlet fever. In case of sunburn rash, go for toxic shock syndrome. Blueberry muffin rash, go for rubella. Macropapilla rash starts at behind the ears, go for measles. That's all. So you need to go for rash drive. Based on the rashes, you can diagnose. Okay, based on the rashes, you can diagnose, my dear. Okay, this is not the time to become panic. Sir, I don't know what is pasture line. My life will be waste. Not like that. Okay, nobody can 100%. Nobody can go to the exam with 100%. I studied everything. No need. Whatever you studied, properly you studied, little you can win. Use your strategy idea. Got it? Next is rash ka flash card milega. Dr. Swapna manifesto. I put it is called rash drive. The name is called rash drive. Rash drive 1, rash drive 2, like that many rash drive I did actually. It's there. I am doing surgical strike with the dermatology people. Dermatology people, rash means you think dermatology, but rash comes in infection. Infection means you think microbiologist also. Okay, right. Next is image shown here is diagnostic of. Sometimes they'll give the image without any history, anything, just image. If you know the image, you can get through. This is epithelial cells. Epithelial cells present. These are all epithelial cells. What is it? It is bacteria. Bacteria embedded. Bacteria embedded on the surface of epithelial cells, linked to epithelial cells. It's a classical feature. Everybody mentioned. Okay, it is called clue cell. It is called clue cell. Okay, sometimes they'll put the picture of Edshar. Edshar. You can see in anthrax, Streptococcus, some other rickettsial infections. Edshar. Same way, clue cell is diagnostic of bacterial vaginosis. Clue cell, very good, very good. Bacterial Vaginosis. Trichomoniasis. You can get a typical protozoa with what motility? Wobbling motility, jerky motility. A typical trophozoite with jerky motility. Gonorrhea. You can get gram-negative diplococci. Kidney shape. That's a keyword. You should know the keyword, kidney shape. Okay. Next is candidiasis. Already told. It produces what? Pseudohyphae. See, this is the typical form of epithelial cell with, I'll enlarge. See here. See. These are all bacteria. These are all bacteria embedded on the surface of epithelial cell. It's a typical clue cell, classical clue for bacterial vaginosis. Bacterial vaginosis. Got it? Right. Yeah. Trichomoniasis, there is a mnemonic called 5. F. Frothy discharge. 5 sets of this flagella is available. 4 plus 1. 5 sets of flagella is there. Many are there. Okay. 5 F. Don't worry. Next is. Next question. A farmer presents with, already I mentioned the word. Next question itself it came. Ulcer, blockage, shore, lymphadenopathy. Selective medium. So, this answer is D. D missing. No problem. Okay. A, B, C, D. Farmer presents with blockage, shore, and lymphadenopathy. Selective medium. You must know about all the selective medium colony morphology. Already made the slide to you 2 to 3 times. I put the slide in the same group. Okay. You can just follow. This is, first you diagnose it as H-shore. You can think of anthrax, cutaneous anthrax. One option is cutaneous anthrax. That is one option, cutaneous anthrax. What is the another option? Second option is Streptococcus. Streptococcus. But easily I can say it is anthrax because Streptococcus non-cultivable. Orientation non-cultivable. So anthrax. What is the selective medium for anthrax? Everybody mentioned it is plat medium. EMJH medium for Leptospira. TCBS for Vibrio. Buffered charcoal yeast extract agar mainly for Legionella. Mainly for Legionella or Nocardia. Mainly for Legionella and Nocardia. You must know about all selective mediums, not only this, all other selective mediums. And colony morphology. What is the colony morphology for Leptospira? Leptospira, it produces subsurface colony, digger's ring. TCBS, yellow colonies, oil, drop colonies. Plat medium, Medusa head colonies or flaccid glass colonies. Like that. Legionella, cut glass colonies. Legionella, cut glass colonies. These are all you must to know. Inverted filtry appearance, where you can get Bacillus anthracis. Aerobic organism produces inverted filtry appearance. Alright. Next is image shown here used to detect. What is the structure called? God's grace. They themselves mentioned Alex gel test. Clue is there. Without name Alex gel you cannot identify because same type of test you are using for many. This is called Achterlony test. Two dimension. Double diffusion. It is 2-dimension double diffusion. Achterlony test immunologically. So what do they use? See carefully. It is positive stain. It produces toxin. This is antitoxin. This is toxin. Toxin spreads like this. Already antitoxin in the gel. So they form a line like this. Where they meet optimum concentration, they form a line like this. It is positive, it is negative. So we are detecting Corynebacterium diphtheria toxin. Diphtheria toxin. We are using diphtheria toxin. Diphtheria toxin. We are using LX gel precipitation test. Gel precipitation test. LX gel precipitation test. Old test. Not in use, but still some things are in textbook. Okay. Some faculties, they want to check your knowledge, whether you studied the book. Many people may be practically good. So whether you concentrated or not, to check something differentiated from other people. If they ask only practical, everybody will answer. Okay, so one or two questions we may anticipate like this. This is one among predictor. Diphtheria, Park William 8 is the vaccine strain. People already writing many things. Okay, right. And diphtheria we have different type of diphtheria. We have different type of biotypes are there. Corynebacterium diphtheriae, gravis, mitis, intermedius. If you want, you remember, gravis produces daisy head colony, mitis produces poached egg colony, intermedius produces frog egg colonies. If you want to remember, otherwise not mandatory. Okay. Next is, a 6-year-old has meningitis with petechial rash. Gram-negative diplococci are seen. Likely organism. Without meningitis, you cannot make a question. Without CNS infection, we cannot make a paper. So CNS infection means always meningitis, meningitis, meningitis and encephalitis. Who are the people causing? 90%, 80% bacteria. Encephalitis associated with mainly viruses. But they concentrate on Streptococcus and Naegleria also nowadays. Nowadays they are concentrating Streptococcus and Naegleria also. So always remember, rash with petechial hemorrhage. That is the clue. Rash with petechial hemorrhage. But age is least likely. It usually affects adolescents and adults. Age is least likely, but no problem. You can go for Neisseria meningitidis. Listeria causes neonatal meningitis. It is gram-negative diplococci. Another clue. Listeria is gram-positive bacilli. Streptococcus pneumoniae, gram-positive cocci, lanceolate shape. Lanceolate shape. Haemophilus influenzae, gram-negative bacilli, pleomorphic. Pleomorphic. Okay, pleomorphic. Make it very simple. Among these three people, this fellow is facultative intracellular, not Neisseria. Neisseria meningitidis extracellular, Neisseria gonorrhoeae intracellular. Neisseria gonorrhoeae is facultative intracellular. Neisseria meningitidis purely extracellular. Purely extracellular. Okay, and people already mentioned it exhibits what modality? Differential modality. All points are flowing like anything. I'm so happy. Okay, good. Next is dimorphic fungi. They will not leave the dimorphic fungi. Still mycology is there. Dimorphic fungi will be there. Okay, growth at 25-degree mold, 37-degree yeast. This is called thermal dimorphism. We call it as thermal dimorphism. Always we have a question on dimorphic fungi. So first you should know the list of dimorphic fungi. This list of dimorphic fungi. So see here. So the thermal dimorphism, based on the temperature, they change the shape. You know my mnemonic, STS. S for systemic mycosis. Okay. Systemic mycosis. Systemic mycosis, which includes histoplasma, blastomyces, paracoccidioides, and coccidioides. Scavenger answered already. STS, T for Talaromyces. Previously Penicillium ornathy, now it is Talaromyces ornathy. And Sporothrix. Dimorphic fungi. Otherwise you can get individual question. Last time they asked dimorphic picture, Sporothrix picture. From the workbook the picture, same picture came in NEET. Okay. Sometimes they will ask about dimorphic fungi. Sometimes you may get superficial question. All are dimorphic except, or which one is dimorphic? Something you can get. See here. Here Aspergillus, it is only septate hyphae with acute angle branching. Candida, pseudohyphae. Cryptococcus, budding yeast with capsule. Histoplasma is dimorphic fungi. Histoplasma is and only subcutaneous fungus. Only subcutaneous fungus which can cause, which is belong to dimorphic fungi is Sporothrix. Subcutaneous mycosis. All systemic mycosis, dimorphic fungi. Got it? One opportunity. Remember Talaromyces ornathy. Make it very simple. Okay, right. One subcutaneous, 4 systemic, 1 opportunistic. All these people usually thermally dimorphic. Some people are there, non-thermally dimorphic also available. I don't want to confuse you. For example, spaghetti meatball appearance. Simultaneously, same temperature you can get yeast short hyphae. Candida also available, pseudohyphae. Yeast. Okay. So don't worry, I don't want to go that much confusion. Make it simple. Thermally dimorphic, keep on asking. Make it easy, my dear. My dears. Next is stool sample reveals motile trophozoite with football motility. That is over, game changer. Football motility. You must know the parasitic motility. One is called falling leaf. Jerky, wobbling, or twitching motility. Okay, twitching motility is Balantidium coli. Football motility. Balantidium coli, football motility, it produces what? Bloody diarrhea, ciliate dysentery. Amoeba also motile. Amoeboid movement with the help of pseudopodiums. Okay, amoeboid movement. It's called amoeboid motility with pseudopodium. Other people are having flagella, typical flagella. This is parasitic motility. If you go to bacterial motility, big list is there. Darting motility, tumbling motility, stately motility, swimming motility, pseudomonas. Swarming, corkscrew motility, lashing motility. Big list is there. Gliding motility by mycoplasma without flagella. Gliding by mycoplasma. Possibilities are there. They may ask anything. Don't worry. Next is organism causes pneumonia and grows on buffered charcoal yeast extract agar. Already I answered the question previously. Buffered charcoal yeast extract agar is a selective medium for 2 people. One is Nocardia, another one is Legionella. Legionella, it produces cut glass colonies. Both causes pneumonia. Nocardia also causes pneumonia. Nocardia also causes pneumonia. Both are capable of causing pneumonia. So I can go for the answer here is Legionella. It causes atypical pneumonia. And Mycoplasma also causes atypical pneumonia. It grows in PPLO agar. All 4 people causes pneumonia, my dears, don't worry. PPLO agar, what is the colony morphology? Bull's eye or target or what is called fried egg colonies. Fried egg colonies. Fried egg colonies. Walking pneumonia, rightly mentioned SK. Okay, water source exposure. If I say Legionella, next minute people finish the chapter. Dietary stain, BCOE agar, urine antigen detection, hyponatremia, diarrhea, walking pneumonia, Pontiac fever, 5 to 7 points, Legionella katham. Over. Got it? Next is, so this gives confidence to you. This is, you believe it or not, this is the same standard of question NEET. The standard, the toughness, the versatility, variation, same level. Same level. I am not increase the toughness. Even my practice questions, test and discussion, sometimes I increase the toughness for you people to break your overconfidence like that. But now I don't want to break your confidence. This is a real level. Believe it or not, this is the real level of questions. Same kind of question they will ask. Which immunoglobulin involved in anaphylaxis? You may laugh. Sir, what is this question? Even +2 student can answer. First MBBS student can answer. The same kind of question they will ask. You know what question? INECT, that's the toughest exam they asked in immunoglobulin. Dimer. Immunoglobulin 3 structure. All immunoglobulins are monomer. Except IgM, pentamer. Secretory IgA, dimer. That's all. When you teach immunoglobulin structure, that is the thing we used to teach first. They ask the question in INECT, dimer picture of immunoglobulin. What is the immunoglobulin? Secretory IgA. Even though they are not mentioning secretory also, they mention IgA. That's all. Got it? So anaphylaxis means IgE. IgA act as mucosal paint. IgA is mucosal paint. IgM millinary molecule. IgG is the one and only immunoglobulin cross the placenta. Transplacental transmission. Transplacental transmission. Mother to child. IgE involved in anaphylaxis. It is otherwise called cytophilic antibody. Cytotrophic or cytophilic antibody. So one question they asked in INECT, based on that, the trend, they may ask some question from immunoglobulin. I put it, basics of immunology. You should know antigen, what are the different type of antigens, antibodies, different type of antibodies, antigen antibody reactions. Like we already taught you, ELISA, agglutination, precipitation, blotting methods, anything they may ask. Possibilities are there. Got it? Next is, and you should know about many things about immunoglobulin. If we discuss, we keep on discussing. Classical pathway activated by IgM and IgG, especially IgG3. Alternate pathway IgA and IgG4. Okay, like we can discuss many things. Shortest half-life, heat labile, IgE. We can discuss many things, don't worry. Next is, always vaccine strain possibilities are there. They will ask one question. Vaccine strain. BCG, we derived from Mycobacterium bovis, Danish 1331. Danish 1331. Not Mycobacterium leprae, no vaccine practically routine. Mycobacterium africanum is a type of MTB complex. So you should know about vaccine strains. If you attended my DVT, I ended with the same two slides. I'm showing you vaccine strains, varicella, Oka strain, measles, Edmonston, Zagreb strain, mumps, Jarellin, rubella, RA27/3, yellow fever, 17D, typhoid, T1, TY21 alpha, rabies, Pittman-Moore, BCG, just now we said Danish 1331, diphtheria, see here, Park William 8, and hepatitis A, HM175, new one. Japanese encephalitis, many are there, live and killed. Live 1442, killed. Nakayama, only Nakayama? Only Nakayama? Okay. Even more detail, the dose, schedule, how to store, everything will be discussed by PSM people. They are also contribute. It's a teamwork, integrated. It's a teamwork. Vaccine preparation by microbiologists and maintenance, administration, protection, everything, PSM and medicine. It's a combination. Okay. Now the time is exactly 4:55. Okay. Just 4 minutes before I am finishing the session on time. Always our sessions are on time. So what is the take home message? You attended this 1 hour. Anything you learned very new, brand new? Anything is very tough? Not like that. What already existing? It's time to analyze. You need to what is called like a supermarket. This is cosmetics. This is toiletries. This is groceries. Like that, you need to make it properly. Store it here. Arrange it. The word correct. I got it. Arrange. It's time to arrange your material in here. When the exam comes, question comes, without panicity, you just like that take. If somebody asks where is the elachi, go to the grocery shop. You will get. Where is the biscuit? You can go to the confectioneries area. You will get the biscuit. Like that, if the question comes, automatically the mind should say it's a pathology question, microbiology question, in immunology, it is bacteria, it's a medium. Like that, like that. You need to know how to arrange properly. You need to arrange. Already arranged. Now the word proper, little proper arrangement. Attend the exam without any panicity. Your panicity is directly proportional, which affect your exam. So panicity indirectly proportional to your preparation. So prepare well, practice well, rock in the exam. Still we have some time. I am in my Telegram group. You can contact me. Any questions you post, I am ready to answer, ready to rectify, ready to help you. Last time help will be definitely useful. We are ready to do. Thank you very much. God bless you. Now the time is exactly 3:57 in my clock. 6 is over. 3 minutes I am leaving you. Be happy. Keep in touch. My blessings, my wishes always with you. You are all always in my prayers.